probably known someone you might describe as, say, a bit dramatic or a total loner. We use these labels all the time, but when does a simple personality trait actually cross the line into a personality disorder? In this explainer, we're going to move past those stereotypes to really understand the core of these complex conditions, and we'll see why compassion is maybe the most important part of the entire conversation. So right off the bat, this is the big question, isn't it? Everybody has a personality, a unique mix of quirks and traits that make us who we are. So what's the tipping point? When does a way of being become so rigid, so ingrained, that it gets classified as a disorder? Let's figure out where that line is. Okay, so our first stop is to draw a really clear line between a personality trait and a personality disorder. And trust me, this isn't just about wording. Getting this difference right is the key to understanding everything else we're going to talk about. So, what do we even mean when we say personality? Well, think of it as your own personal operating system. It's the pretty consistent way you tend to think, feel, and act across different situations. It's what makes you, well, you. And here's where that line gets drawn. A personality trait, that's just part of your unique style. It influences how you see things. But a personality disorder, that's a pattern that becomes inflexible and pervasive. And here's the absolute key. It causes real distress. It actively gets in the way of major parts of life, like keeping a job or having healthy relationships. It's not a quirk. It's a source of genuine struggle. I love this analogy. It just makes it all click. A trait is like your favorite jacket. You can take it on or off. It's part of you, but it's flexible. A personality disorder is like being stuck inside a suit of armor. It's rigid, it's heavy, and it makes it incredibly hard to just move through the world and connect with people. All right, so now that we get the difference, how do experts even begin to make sense of all this complexity? Well, to organize these conditions, they're grouped into three main categories, or what they call clusters. The official guide, the DSM-5, actually lists 10 specific personality disorders. And yeah, just looking at that list can feel kind of overwhelming, which is exactly why the cluster system is so helpful. So those 10 disorders get sorted into these three clusters. Think of it like a filing system. Each cluster groups together disorders that share some core features, and that gives us a much better framework for understanding them. And here they are. You've got cluster A, which is the odd or eccentric group. Then there's cluster B, the dramatic, emotional, or erratic group. And finally, cluster C, the anxious or fearful group. So let's just quickly break down what each of these looks like. First up, we've got cluster A. The common thread running through all the disorders in this group is a kind of social awkwardness and a tendency to withdraw from others. These are behaviors that people might see as peculiar or a bit strange. So inside this cluster, you have paranoid personality disorder, which is rooted in this deep, constant mistrust of other people. Then you've got schizoid, where the person really has little to no interest in forming relationships at all. And finally, there's schizotypal, which involves some odd beliefs and behaviors, sometimes including things like magical thinking. Okay, next up is cluster B. This group is probably the one you've heard the most about. These disorders are all about behaviors that seem dramatic, incredibly emotional, or erratic. Impulsivity and really turbulent relationships are the big themes here. This cluster includes antisocial personality disorder, which is marked by a consistent disregard for the rights of other people. There's borderline personality disorder, known for its really intense emotional ups and downs and chaotic relationships. You also have histrionic personality disorder, which involves a constant driving need to be the center of attention. And then there's narcissistic personality disorder, which is defined by this huge need for admiration and a real lack of empathy for others. And that brings us to our last group, cluster C. The disorders that fall in this bucket are all tied together by one central theme: high anxiety and behaviors that are really driven by fear. Here you'll find avoidant personality disorder, where a person's fear of rejection is so intense they might avoid social situations altogether. Then there's dependent personality disorder, which is about an overwhelming need to be cared for by other people. And finally, obsessive-compulsive personality disorder. And it's really important to know this is different from OCD. This is about a rigid fixation on order and control that actually gets in the way of getting things done. Okay, so we've kind of mapped out the landscape, but honestly, the most important questions are still coming. Where do these patterns even come from? And more importantly, what does the path toward getting better actually look like? Right? It's so important to get this. There is no single cause. Not at all. Researchers are pretty clear that these disorders come from a complicated dance between our genetics, our nature, and our environment, especially our early life experiences, our nurture.
So the process often looks something like this. A person might start out with some kind of inherited vulnerability or temperament. Then you combine that with really difficult environmental factors, things like childhood trauma or neglect, and the result can be the development of these rigid, long-lasting patterns of behavior.
And if you want to see just how powerful that environmental piece can be, listen to this staggering statistic. Studies show that up to 90% of people diagnosed with borderline personality disorder also have a history of childhood abuse and neglect. That's a huge number, and it's a really stark reminder of how much our early experiences shape us. And this all leads us to the most hopeful and important message of all. Personality disorders are absolutely treatable. A diagnosis is not a life sentence. There are real, evidence-based ways to manage these conditions and build a much, much better life. Now, the path to treatment is definitely not one size fits all. The foundation is almost always some form of psychotherapy or talk therapy. Some kinds, like CBT, help people change harmful thought patterns. There's a specialized type called DBT that is incredibly effective for borderline personality disorder because it teaches practical skills for managing those intense emotions. And while there's no magic pill for a personality disorder itself, medications can be a huge help in managing related symptoms like anxiety or depression. When you boil it all down, it's so crucial to see these conditions for what they really are. They are not character flaws. They're not moral failures. They are complex mental health challenges, and just like any other health challenge, they require understanding, compassion, and professional care. And really, the whole path forward is captured perfectly in this advice for caregivers. Approach patient care with patience, empathy, and a focus on a therapeutic relationship. And you know what? That advice holds true whether you're a doctor, a friend, or a family member. Patience and empathy. They're everything.
So we end up right back where we started, but hopefully with a totally new perspective. The goal was never just to put labels on behavior, but to try and understand the struggle behind it. And recognizing that difference, the difference between who someone is and what they're battling, well, that's the first and most important step toward genuine compassion.